everybody, it's Andrea Tooley from AndreaTooley.com. I'm here to answer one of the email questions I've been getting a ton, and that is about why I chose ophthalmology. So as you know, I'm a resident physician, which means I graduated from medical school 2 years ago, and I'm in my second year of residency. And if you don't know what residency is, or you have questions about kind of the transition from medical school to residency, or from college or university to med school to residency, you can check out, I have a couple different videos where I talk about this. One is stuff about medical school I wish I had known when I was in college, and that kind of talks about the transition. But anyways, now I'm in residency, and people always ask, do you get paid to be in residency? And yes, you do. So this is my full-time job. I am a full-time resident physician at Mayo Clinic, and I am now studying ophthalmology. So ophthalmology is the study of eyes and eye surgery. And so you deal with all kinds of pathology in the eye and systemic illnesses of the body that affect the eye as well. And then ophthalmologists do all kinds of amazing eye surgeries. Really simple ones that you've probably heard of are like cataract surgery. We treat patients with glaucoma, with retinal issues, all kinds of things. And then on the flip side of ophthalmology is optometry, which is a very related specialty, except that optometrists don't go to medical school, they go to optometry school. And optometrists deal a lot more with refractive error of the eye, so prescribing glasses and helping people with low vision. They specialize in contact lens, all kinds of things like that. And they also can treat different diseases of the eye as well, and they're kind of like the first line to see patients and then often refer them to ophthalmology if they're concerned about glaucoma or something in the retina or something like that. So we kind of work as a team here at Mayo, and now that I'm in the beginning of my residency, I get to spend kind of half day with optometrists and learn all about prescribing glasses and learn the optics and all the science behind that, which brings me back to physics in college. It's crazy. And then I spend the other half day in our kind of emergency medicine resident run clinic, where we see all kinds of emergency eye conditions, which is amazing. I'm just learning so much because you never know what'll walk in the door, and it's just outstanding. So people ask me why I chose ophthalmology, how I knew I wanted to do ophthalmology, and I just thought I'd take a few minutes to just tell you what I personally like about it and why it was the specialty for me. So I decided that I wanted to do ophtho when I was actually in high school, which is really unusual because most people don't know a lot about ophthalmology unless you happen to have an ophthalmologist in your family. But I was introduced to a nonprofit organization called Orbis, which is a group of not only ophthalmologists, so eye physicians and surgeons, but nurses, engineers, all kinds of different people whose mission is to eliminate blindness worldwide, and they travel overseas and they help people with eye conditions all over the world. And I found out about this organization when I was in high school and read a little bit about it online and just knew that that was it. I had to get involved. That's what I wanted to do kind of with my life. It just sounded so incredible to me. And then the more I learned about ophthalmology, the more it interested me. And so I really became fascinated with the eye and the pathology of the eye. The eye is unlike any other organ in the body. It's like its own little world, and it has such unique characteristics that you don't even really learn about in medical school. And I just thought it was incredible and just kind of mind-blowing, all the amazing things that the eye does. And then I also really liked how much of an impact you can have in a patient's life. So if someone's vision is threatened and then you can fix that, you've made a huge impact on this patient's life. And so to help someone who's had lost vision, then to get that vision back, or to do a simple surgery like cataract surgery and be able to give someone better sight, I just think is the most gratifying thing. And to spend my career helping people see better seems like just a dream. And so I really liked the kind of impact you can have in patients' life. I don't know a better way to say it. So those were a few things I liked. And then when I went to medical school, one of the first things I started to realize that I was looking for in a career was kind of a balance between continuity, meaning seeing some patients over the long stretch, seeing some patients for a very long period of time, and then also having some patients that just come and go that I don't see very often. So for example, if you're an emergency room physician, you see a patient for a couple hours and then you may never see that patient again in your whole life. I mean, there's certain people who come to the emergency room a lot, and so you might actually start to know people if you work in the emergency room. But for the most part, there's not a lot of continuity with those patients. You don't necessarily know what happens to them after they leave the ER, and you kind of have your time with them and then they're gone from your care. Versus something like family medicine or some other specialties where you have long-term continuity, where you might treat the same patient for 20 or 30 years and kind of see them throughout their life. And so I loved that relationship that you build with patients over the long term, but I didn't want that with everybody. And so I like that in ophthalmology you have many patients who you'll see for years and years and years, and you build a relationship with them, you know them very well over the years. But then you have other patients who come in for cataract surgery, you do their surgery, and then you might not see them again for many years. And you might not see them again at all. And so it just kind of depends, and I really like the balance that you get between that. And another thing I really liked about ophtho was the balance between clinic time and OR time. So for me, I knew I wanted to be a surgeon. I absolutely knew I wanted to do some kind of surgery from when I was in high school and decided that I wanted to do medicine. I just love working with my hands. I feel like I'm a very dexterous person, and I feel, I mean, I'm not a surgeon yet, but I feel like I'll be good at it. I just really love kind of the intricate, fine handwork, and I love that that's your craft, and it's really kind of an art that you cultivate, being able to be a surgeon and kind of successfully do these invasive things to a patient and help them. So I really love the concept of doing surgery, but I didn't want to be in the OR all day, every day. And when I was on my general surgery rotation, there were cases that were 9, 10, 11-hour cases, and even short cases were 3 or 4 hours. It's not unusual to have a surgery that lasts multiple hours. And to me, that's just exhausting and grueling. And I also didn't like the big nature of general surgery, like the big abdominal incisions, and just like all this blood and stuff. I really liked more of the intricate, very detailed, tiny microscopic surgery in ophthalmology. And almost all the surgeries in ophthalmology are microscopic surgeries. You do them under the microscope. And so I really love that. The surgeries in ophthalmology are very short. Most are under an hour. A long ophthalmology surgery would be a couple hours. And so you don't spend your entire day in one case. You could do 5 or 6 cataracts a day, or maybe many more. Some surgeons can do cataract surgery in like 10 minutes. It's unbelievable. And so I really like that it's fast and it's very delicate and kind of clean and small and contained. It just seems perfect for me. I really love that. And then, you know, when I started medical school, I tried to keep a really open mind. I told myself that I would explore everything and enjoy everything. And if I ended up falling in love with something else that wasn't ophthalmology, then that was great. I didn't want to be closed off about it, even though I kind of knew that's what I wanted to do when I started medical school. And I honestly loved everything in medical school. I loved everything I learned. All my rotations were fantastic. There were only a few that I didn't really love. But really they were all great. But I kept coming back to ophthalmology, and it just kept winning out over everything. It was more interesting to me. I liked the patients, I liked the clinic. I like how in ophthalmology there's a very focused physical exam, so you don't have to do like a head-to-toe physical exam. You're just doing the eyes. And to be able to look in the back of the eye is a skill. You have to use lenses and mirrors and light, and it's difficult. And I'm learning that now. I'm learning how to do a good retinal exam, and it is not easy. And so I love that you have this unique skill that you have to train for and learn, and then you can be kind of a master of your craft. And really the ophthalmologists are the only ones who can look in the back of the eye. There aren't any other physicians. Maybe neurologists can look at the optic nerve, but to be able to see the whole retina is not easy. And so I love that there's such a set skill, and when somebody comes into the clinic, you have a set exam that you're doing. You're doing a slit lamp exam. You're looking with the indirect ophthalmoscope to look in the back of the eye. And so I like that it's very focused. And Really just everything kept winning out for me, all the things I liked about ophthalmology. And then last, it's a good life balance career. You know, I wanted a career where I knew I could have time outside of clinic, outside of the office. And there's some specialties in medicine that are more demanding than others. And there's some where you have to be in the OR, be in the clinic more time than others. And ophthalmology's, you know, we work really, really hard, and residency is really hard. But when you're out in practice and you're out in clinic, you can have a pretty great lifestyle and balance kind of time in and out of the hospital. And so those were all kind of things that I really loved about the field. And now that I'm there and I'm learning, I just love it more. I think the eye is just such a mystery, and to learn all of the incredible things that allow us to see and how the eye works is just, oh, it's the coolest thing ever. So I love it. That's why I chose ophthalmology. I hope this helps you out if you were wondering you know, what it is I liked about it. And if you're in medicine, or if you're interested in a medical specialty, I'd love to know what interested you about that particular specialty and why you chose it. So hope you like this video. Don't forget to subscribe to this channel so you never miss another video. I'll be posting new videos every Monday. And if you have any other questions, you can find me at andreatooley.com or on Instagram or Twitter. And I'll talk to you guys later. Bye.